refugees, and then I'll also try to discuss a little bit about the current situation with refugees and why it's still important for us to work on this specific topic. So let's see. I'll try to do the first part without the PowerPoint slides. So first things first, let's start with the history of IFMSA. So IFMSA started off in 1951, and it was one of many organizations that started right after the Second World War. We had 7 national member organizations in the beginning, and now we have over 100 national member organizations and more than 1 million members across the world. We have a vision within IFMSA and also a mission. So I was trying to figure out how to summarize it in the best possible way, but the vision is that we have a world in which all medical students unite for global health, and that we are equipped with the knowledge, skills, and the values to take on health leadership roles locally and globally. In our vision, we try to unite medical students worldwide to lead initiatives that impact positively the communities that we serve, for instance, in regards to refugees or other vulnerable groups. In the mission, it also mentions capacity building, which Michael will be talking about later on, and it also mentions collaborations with external partners, which Karim will be talking about later on. And now specifying SCORP and what we do, we started off in 1983 as the Standing Committee of Refugees. So we were working on raising attention to the problems that displaced people faced and try to participate in relief efforts. And that's what our members are currently still doing throughout the globe in activities and projects that they have locally and nationally. Moving on, I'm going to try to now focus in on why we should work on this. And let's see, I'm going to move on to my presentation. This is the first time I'm using this program, so I hope I'm going to be able to do it. Just let me know if you're having issues seeing my screen. Slideshow, and we will start. Okay, awesome. So you can see my screen now, right? Just let me know if there's any issues or any kind of questions that you might have as well throughout this presentation. So moving on, we've already talked about the history of IFMSA and discussed how we started, our vision and our mission. Let's see if I can try to jump onto the slide that I want you guys to see. There we are. Okay. Yeah, now it's working. So why is it still essential for us to work on ensuring the rights of refugees? So we're going to go through some facts now. The first facts are on the current situation, so some basic facts. Currently, there are over 65 million forcibly displaced people. Of these, 21.3 are refugees. And when trying to figure out where refugees mainly come from, 54% of the refugees, they come from 3 countries in particular: Syria, Afghanistan, and Somalia. And to just highlight what a refugee is, because sometimes the terms are misused or misunderstood in regards to who's a refugee, who's a migrant, internally displaced persons, etc., etc. But a refugee is, in summary, a person that flees conflict and persecution. And I just wanted to highlight that in the Universal Declaration of Human Rights, it states that everyone has the right to seek and to enjoy other countries' asylum from persecution. And these kind of documents, Karim will be talking more deeply about. So I'm going to move on. Let's see. I'm trying to click, but maybe it's not working. Okay. So, major source countries of refugees. As I stated, Syria, Afghanistan, and Somalia were on the top of the list, but we also have other countries on the top 10. And most of them, as you can see, are from the African region, the African continent. We have South Sudan, Democratic Republic of Congo, Central African Republic, and Eritrea that are from the African region. But then we have the Eastern Mediterranean region with Syria and Afghanistan, well, sort of Asia Pacific as well. Myanmar, from the Asia Pacific region, and then we also have from the Americas, Colombia, which has a high number of internally displaced persons as well. I just wanted to highlight as well children's rights, and that a high number of refugees are children. Over 50% are children. And many of them are also unaccompanied, and they face a lot of issues. And we have a lot of obligations connected to making sure that children's rights are respected. And I think Karim might mention that as well. I'm not sure. Sorry if I stated something that you won't be presenting. But those are also some things that we need to keep in mind to ensure that they are safe and that their rights are respected. So where do refugees flee to? And to get the facts straight regarding this, I try to highlight the regional distribution. So as you can see, all regions do have refugees fleeing towards those regions. Europe has the lowest percentage of only 6% of refugees go to Europe. Next is the Americas region, which has 12%. Then we have the Asia Pacific region with 14%. We have the African continent with 29%. And then we have Middle East and North Africa, which account for the largest percentage of 39%. Another important thing to highlight is that a huge number, 86% of the world's refugees, are hosted by developing countries. So let's look deeper into it. The major refugee hosting countries, we have the top 10. It's Turkey. And you can see here also, it shows the end of 2015 and the start of 2015. So they are two different colors, green and blue. And yeah, so top is Turkey. We have Pakistan, Lebanon, Iran, Ethiopia, Jordan, Kenya, Uganda, Congo, and Chad that are the top 10 refugee hosting countries in regards to number of refugees they have, and it's counted in millions. I also wanted to show you the number of refugees per 1,000 inhabitants and the top countries there. It varies a little bit in comparison to the number of million refugees that they host. So on top of the list we have Lebanon, that has 183 out of 1,000 inhabitants that are refugees. Then we have Jordan, we have Nauru, and we have Turkey, Chad, Djibouti, South Sudan, Mauritania, Sweden, and Malta that are on the top 10 list. And Nauru, it's connected to Australia, so and their refugee and migrant legislations. So maybe you can read up on that as well, why they have such a high number. So that's my presentation. Let me know if you have any questions of any sort, and I'll try to be as available as possible.
Thank you very much, Hana, for your amazing presentation. I just want to tell all the people who are listening to our webinar that on the right side, you should have something like a chat window to which you can also write your questions or write any interesting point, or just communicate with us and with other people listening to the webinar. So right now, we are going to continue. I'm just looking how to change the presenter. Okay. So as a second speaker, we are going to continue with Karim Abdeltawab, our liaison officer for human rights and peace issues. and he will speak about advocacy and our external work we do in IFMSA and SCORP in the topic of refugees and asylum seekers. So right now I'm giving the screen, okay, not the screen, but I'm giving the word to Karim. Karim, can you hear us?
Thanks, Michael.
Okay.
Yes, I can hear you. Can you guys hear me?
I think yes. Yes.
Perfect. Thanks. Thank you for the introduction. Thanks, Hana, for your presentation. Just first of all, I want to apologize for not having my camera on. I'm on my phone, where I can have the best network possible. So I won't be able to turn on my camera, but I will try to make this as interactive as possible. What I'm, like Michael has discussed, going to discuss is advocacy and the external work for IFMSA and the Standing Committee on Human Rights and Peace Issues, what work we do externally, or what sort of advocacy we do externally on refugees. But before we jump into what IFMSA does around the area of advocating for refugees' health and rights, let's just see what global policies govern the refugees' rights. For a starter, we have before we go right into the global policies, let's just see what rights are entitled for refugees. Articles 12 to 30, for example, of the Refugee Convention that is that has set out the rights which individuals are entitled to once they have been recognized as refugees, state that refugees have the rights to receive the same treatment as nationals of the receiving country with regard to the following rights. So they have freedom to exercise their religion and religious education, freedom to elementary education, to social security, to intellectual property such as inventions and trade names. They also must receive the most favorable treatment provided to the nationals of the foreign country in which they're hosted with regard to the following rights, such as the right to belong, for example, to a trade union or belong to a non-political, non-profit organizations. There are just there's a lot of rights that are entitled to refugees that really give them the freedom to live in a country just as the residents or as a foreigner who's living in the country and working as an expat. They also should receive the same treatment as that accorded to aliens generally. So aliens here we refer to the expats coming in and working in the country with regard to the following rights, for example, choosing their place of residency, the ability to move freely within the country, access to elementary education, which we mentioned earlier, for their children, equal treatment by taxing authorities, and so on and so forth. So these are just a few simple rights that are entitled for refugees once they go into the hosting country. And if we were to look up the different rights, we can find a huge list of rights that are entitled to refugees that are governed by the different conventions and frameworks that we will discuss in a minute. But before we go to the global policies and the conventions, we will just try to map the key players or the key assistance agencies that are that facilitate the refugees' integration and facilitate advocacy for refugees' rights on the international arena. We have the first organization with us is the United Nations High Commissioner for Refugees, and the UNHCR was actually created in 1951, so it's pretty old, to assist international protection of refugees. Its primary objective is to ensure that all persons can exercise the right to seek asylum and find safe refuge in another state, and then return home voluntarily. Although originally UNHCR's mandate was not to coordinate material assistance, nowadays it has become one of their big principles and functions alongside the protection and promotion of solutions. So now they also coordinate material assistance for refugees in different parts of the world where there are camps and so on. The other organization we have is the International Organization of Migration, which also is based in Geneva, both with UNHCR. They assist with the return of asylum seekers and refugees who were referred by the UNHCR and are often rejected back in their home country. So they try to facilitate the return either to their home country one way or another, or to other countries that are willing to host them. Another organization we have also is the International Committee of the Red Cross, which is an independent humanitarian organization. It acts very neutrally in assisting and protecting victims of war, from providing medical care to the victims, arranging exchanges of family messages, and so on and so forth. ICRC is now considered well placed to provide help for refugees in humanitarian and crisis situations because of their critical role of being in conflict settings where not a lot of other non-governmental organizations are allowed to. So because the ICRC is allowed to be present in conflict settings because they have a neutral stance on when it comes to conflicts, they're allowed to be in such war zones and be able to provide help for a lot of the fleeing members or a lot of the fleeing citizens of a country going to another country. Now, going into some of the global policies that govern all these rights and all the advocacy work around what the advocacy work around refugees' rights and health, we go way back early to 1948 for the Universal Declaration on Human Rights, and especially Article number 14, which states the first, or actually it was the first international document that recognized the right to seek and enjoy asylum from persecution. So the Universal Declaration of Human Rights was the oldest and the first to actually recognize the right for to seek and enjoy asylum from persecution, like Hana has mentioned earlier as well. Just 1 year after that, in 1949, the Geneva Convention relative to the protection of civilian persons in the time of war, especially Articles 44 and 70, this treaty protects refugees during war. Refugees cannot be treated as enemy aliens. A bunch of years after that, in 1977, there was one more protocol that was added to the Geneva Conventions, which was very crucial, which states that persons who before the beginning of hostilities, that is before the beginning of war or any other conflict, were considered as stateless persons or refugees in that country should be protected persons in all circumstances and without any adverse distinction. So it was very essential to add this protocol to the Geneva Convention because it stated that refugees and stateless persons living in a country that's going into war should also be protected because they had been fleeing from a country that has been into war. They also should be protected in the hosting country as well. Now, to me, what I think is one of the most crucial conventions for refugees is the Convention relating to the status of refugees in 1951, that was adopted in 1951, was the first international agreement ever covering the most fundamental aspects of a refugee's life. It spelled out a set of the human rights that should be at least equivalent to the freedoms enjoyed by foreign nationals living legally in the country in which they're hosting, and that is hosting the refugees, and in many cases to enjoy the same rights as those of the civilians in that state. It also recognized the international scope of the refugee crisis, which was really never addressed prior to 1951. And it also addressed the necessity for international cooperation and sharing the burden of among states from hosting refugees. I don't really like using the word sharing burden because it makes it sound very bad when we're discussing refugees going into host countries, but these are the terms used when it comes to hosting countries collaborating together, so sharing the extra burden of refugees coming into their countries in tackling the problem. In the 1st of October in 2002, we had 141 countries that had ratified the Refugee Convention. But just let me tell you that because it was a non-binding convention, many of the signatories have actually not abided by the rights and the rules that were set in this convention. So this has really created the problem which we're facing today, because even though we have the convention relating to the status of refugees, which to me is one of the most crucial, it has not, many of the countries that have signed it, because it's a non-obligatory convention, have not actually abide by the rules of it. So moving from that, we can go into what IFMSA does around the area of refugees and internationally, and what do medical students actually call for. On our last General Assembly that was held in Malta in March, we had called upon governments to hold accountable any contributions to be held accountable for any contributions to forced migration, such as financing or participation on conflict, We have also called for the respect of international human rights and humanitarian laws by ensuring the rights of asylum seekers and refugees, ensuring that their rights are respected and that they are treated with dignity and without discrimination and arbitrary detention. We have also called to create and promote safe legal routes that people need for people needing protection can access in order to reach the country they're seeking asylum to without endangering their lives. We've also called to respect the fundamental principles according to the UNHCR, abstain from expelling people to any country where his or her life would be threatened, and many other calls and obligations that we have asked governments to abide to and contribute to resolving the refugees crisis. So this is what we have in IFMSA right now, is this policy statement that guides most of the work that IFMSA does around refugees and advocating for refugees' rights. Last June, well, which is a month ago, there was the UNHCR NGO consultation on refugees, and the theme of that event was youth. And IFMSA had participated in that event and had really a very great participation. From that participation, the overall theme, like I mentioned, was about youth, and IFMSA had facilitated one of the big sessions on sexual and gender-based violence among refugees. And because our World Human Rights and our World Refugee Day campaign this year tackles sexual and gender-based violence, it was also very relevant. Some of the key things that we had mentioned, or some of the key messages that came out from the UNHCR NGO consultation on refugees addressing sexual and gender-based violence towards refugees, was that services needed to be accessible and impartial, understanding community and acknowledging the diversity in context of refugees moving into different countries. IFMSA has also called for to increase training for medical students and medical practitioners so that they're more sensitized to the challenges female and male survivors of sexual and gender-based violence face when they're trying to access these services. We have also addressed other key issues like targeted outreach being essential to reach the marginalized groups, as not having just simple open policies that address sexual and gender-based violence. We need to go to the countries, we need to go to the areas where there's really high incidence of sexual and gender-based violence towards the refugees, and have targeted programs that address such marginalized groups. And also just highlighting that among 50% of the early pregnancies that refugee girls suffer were caused by their teachers, which is another thing that goes, another challenge that most of the refugee girls face when they're seeking education. So we can see here how sexual and gender-based violence against refugee girls can also affect the outcome, the long-term goal of them achieving their education and their integration into the society and so forth. So I think I would rather give the floor for questions, but I know we have that at the end. And I don't know, I think I've also spoken way out of time. So that's the end of my presentation.
So
thank you guys for listening. I'll stick around for questions, and hopefully have a bunch of questions to ask.
Thank you very much, Karim, for your presentation. Actually, it didn't go over the time, so it was really well planned from your side.
Perfect.
So right now, also Karim already mentioned that if some of you would like to ask any questions, you can also use the application, because I already answered some of the questions you asked about mostly technical side of our webinar, but also you can ask questions in the chat and we'll try to answer them in the end in our questions part of the webinar. So right now, after Karim's presentation, we will switch to my presentation. So I'm Marián Sedlák, I'm SCORP General Assistant. Let me share you at the beginning my camera with you. Hi guys, I'm right now in my local committee office, so it's not so clean here, so I will turn off my camera for my presentation, for the duration of my presentation. So right now, I hope you see my screen. I'm going to switch to my second presentation about the issue I will speak about. So capacity building, and let's hope I will be able to. Okay, at first I need to cancel the first presentation, and right now I'm switching to this one. Okay, awesome. I really hope you are able to see it. So, as Karim already mentioned, IFMSA, as one of the biggest federations in the world, one of the biggest students' organizations in the world, already mentioned the need for the extensive training of medical students and future healthcare leaders in the topic of refugees and asylum seekers, migration, and their rights. So right now we are going to speak about capacity building and mostly about migrants and refugee health and rights, which is the title of our workshop connected to migration and issues connected to it. So at first, let me tell you something about the content of my presentation. So we'll talk a little bit about capacity building in IFMSA generally and in SCORP. And then we will talk a little bit about exactly migrants and refugee health and rights workshop and its goals and objectives, because when you are planning a capacity building activity, it's really important to also cover it from the project management style. So we will talk about that, and then we will talk about two workshops which were already conducted in Macedonia and in Jordan, and how did they go, and about the agendas, and I will show you some pictures. And then we will talk about other activities connected with refugees and capacity building in SCORP, and about the follow-up from this webinar. So let us start with the capacity building and SCORP. So as Hana already told you at the beginning of this webinar, the mission of IFMSA, maybe you remember, is to offer future healthcare leaders comprehensive introduction to global health issues, therefore to equip medical students with skills, knowledge, and values to create a positive change in communities, both on local, national, and global level. The IFMSA has a long history of engaging on issues of migration and its connection to health. So as Hana already told you, in 1983, the Standing Committee on Refugees was formed, and its aim was to call attention to the problems faced by the displaced populations all around the world and to participate in relief efforts. But the members of the committee realized that these efforts, which they have done under the name of this committee, were aimed only at refugees and were not so efficient, because we know that the whole problem of displacement and refugees and overall problem of migration is really complex and broad. So they realized that the sustainable solution would have to address the root causes of the problems, so which are violence, conflicts, and human rights and peace violations. During the past years, and also since the beginning of this standing committee, which is now called SCORP, many NMOs around the world have worked with refugees in their own countries. And I think during the late 2000s, a project with transnational status, which doesn't exist right now in IFMSA, it was called Crossing Borders for Health, was created to coordinate actions of some NMOs to raise awareness about and advocate for better engagement in migrants and refugee health issues internationally. But since, as you may already know, in recent past years, IFMSA as the federation is switching to ideology, I would say, of programs-oriented approach, and the two big SCORP-related programs were created. The first one was Dignifying and Non-Discriminatory Healthcare and Emergencies and Disaster Risk and Humanitarian Actions was the second one, and they aim to work with topics connected to refugee and migrants' rights and healthcare. But in order for all programs to work effectively, we need a capacity in these areas and in our NMOs and in our federation. And what does it mean exactly? Because we are mentioning capacity building all the time, and capacity building here, capacity building there. So the official definition of the capacity building is it is the process of developing and strengthening the skills, abilities, instincts, processes, and resources that any organization or community needs to survive, adapt, thrive in the fast-changing world. So basically, applied to our federation, Capacity building is the knowledge we build among medical students in our national member organizations, in our local committees, in your associations, in your universities. So we are building the knowledge, you are giving knowledge to people, you are improving their skills, their experience, and therefore then they are able to act in those topics of, right now we are mentioning migration and refugees, but you can apply this capacity building to any of your activities and any of the topics you are working in your organizations. So in this slide, you can see some of the capacity building activities we do in SCORP. So from the workshop named TNHRT, Training New Human Rights Trainers, which you may already know. Then on the right side, we have training disaster medicine trainers. This is the newest workshop we have in SCORP. It has, like, the aim of it is to also tackle the issue of disaster risk management and disaster risk reductions. Then we have also advanced human rights for medical practitioners, which you can see on the left at the down corner, which was conducted also during the SCORP camp in Sweden and also during the pre-GA in Malta, which we had right now in March. So those are some workshops which are currently established in SCORP. But then we have also some other ideas and some other workshops going on around the world, not unified, but they have been conducted a couple times. And right now I would like to go to the workshop which represents our refugee and migration issue. So as you already know, we call that workshop Migrants and Refugee Health and Rights. I'm trying to move my screen right now, but it doesn't want to change. So just give me a few seconds. Yes, so it's here. So we had workshop called Migrants and Refugee Health and Rights. It was conducted 2 times right now, up till now. The first time it was conducted was during the pre-GA in Macedonia in 2015, August meeting. And the second time, it was conducted during the pre-Eastern Mediterranean regional meeting in January in Amman, Jordan, this year. And at first, goals and clear objectives for those workshops was because we wanted to tackle some issues connected to refugees and migration. So the first one was basically to provide participants and medical students with core knowledge on the right to health and other relevant human rights in the context of health and migration. The second one was to demonstrate the importance of health as human right and the role of healthcare workers in improving the health of both refugees and the communities they work in, they live in. The third one was to manifest ways in which the health of refugees is affected throughout the course of the migration process and while living in refugee camps. The fourth was to provide participants with basic knowledge on how to approach patients either asylum seekers, migrants, or refugees who experience trauma, torture, or cruel, degrading, or inhuman treatment. Then we had to offer participants to have basic understanding in current migration policies and asylum systems, as well as their impact on the lives of the population and concern and of the general public. So that's really important because, as already Karim told you, we have some international policies which are changing quite fast, and that's why we need people to be aware of those issues and those policies. And then the sixth objective would be to provide an overview of migration's impact on the society, that also from countries they leave as well as the one that they arrive to, and some cultural and social benefits of migration, because migration and refugees and people coming to other countries, it definitely has benefits, not only bad things that as people present with the medias right now throughout the world. So let's go to the second slide. As you can see, we have many of those objectives because, like, the problem of refugees and migration is really broad. So the seventh one would be to investigate the perceptions of refugees in different societies across the world, consequences of these perceptions, as well as factors affecting them. The eighth one, to empower participants and provide them with tools to act as advocates for human and refugees' rights, human rights and refugees' rights, and to raise awareness among other medical students and to implement their own projects on a local level. So let's go quickly through other ones because we are running out of time. So to provide a forum for students interested in advocating for human and refugee rights, to network, exchange ideas, and learn about each other's experience in these fields. So maybe you know there was some initiative which was called Refugees Health, and I'm not sure, we had a Facebook group and like really working group around this topic, but right now it is not so active as it was before, but we are still doing some initiatives to wake it up and continue with it. And with the last three objectives, to increase the participants' understanding of reasons for voluntary as well as involuntary migration, to facilitate partnerships between the medical students community and international organizations working on migrants' health, education, and social issues. And the last one would be to highlight the opportunities within as well as outside of IFMSA for taking action on the topic of migration. So that's why we wanted to conduct those workshops. Those were two different workshops conducted in two different regions, but the idea behind them was kind of similar. So this is the first workshop which was conducted during the August meeting in Macedonia during the pre-GA. So the coordinators were from different countries, from Greece, from UK, from Sweden. Also Jessica Zhang, our current development assistant, and me myself were included in the coordinators team. So you can see the picture. And when you want to talk about the sessions we have covered in this workshop, we had human rights and migration history today. Why do people migrate? So some basic knowledge which is behind the topic of migration and topic of refugees. What are the differences between those two nouns? Because people are very easily exchanging those two verbs and might like to migrate and to be a refugee, and also exchanging the meaning of those two nouns. We have also covered the topic within the IFMSA as we are covering it right now, policy statements, programs, and here you can see our interactive activities we have conducted during this workshop. And our second day was mostly conducted by our external speakers. So at first we had the road to safety and success. So migration in the framework of policies, asylum system and legislations, which were covered by Lilana Kidd. She was the speaker from the organization named PICUM, which stands for Platform for International Cooperation on Undocumented Migrants. And then we had also two external speakers from Doctors Without Borders from Greece. Namely Dr. Apostolos Vezis and Dr. Aliki Meymerdu, and they were speaking about health of refugees, about the epidemiology, hands-on experience, and Aliki was speaking about the mental health and mental health in refugees, and how we lack mental health healthcare and provision of mental health healthcare. So here we can see our development assistant Jessica with Apostolos and Aliki. And here is the Apostolos conducting his session on refugee and hands-on experience. So, and this was the third day when we went through more specific topics in regards to refugees. So the first one was barriers to health and healthcare, conducted by Joža Šmuch, our SCORP director. And then we had, for example, parallel sessions on torture and human trafficking. Then we had the second workshop conducted in Amman in Jordan, which you can see here on the pictures. So you can see also Jessica, which is really active in the field of refugees and migration. And right now you can compare the agendas. We will share the presentations with you after the workshops, and don't worry if you are not able to read it right now. This workshop was kind of different and aiming to tackle mostly the topic of refugees, more refugees, not migrants, but refugees in the EMR staged, let's say, environment. So you can see they were covering the human right to health, also refugees and migration history and today. They had also understanding and reducing the prejudice, the view of refugees. So it was kind of similar, and but they were tackling mostly the topic of refugees. They had also the field visit to the United Nations Relief and Works Agency for Palestinian refugees in the Near East. And this workshop was conducted by Hana, our director, who was speaking at the beginning, also Karim, who was speaking right before me, also Jessica, and then Emir from Turkey. So it was conducted during the pre-EMR this January. So basically, these are some last pictures from this workshop. And right now we are finishing with the time, but I want to share with you just the last activity we do in SCORP with refugees. So maybe you have played. This game was kind of derived from some similar games which are played from other international organizations, but we have created our own one, but it got an inspiration from those games. It's called On the Run, and it offers participants a clear experience and really like on the skin experience of how to be a refugee and how is to flee. And we will share with you the sheet with this game and how to play it in the follow-up email. So maybe some of you also played this game and learned something. And I think it's really good because it gives you the feeling how to be a refugee and how to feel the story of people who have to flee. So thank you very much. I hope I didn't go over time. I didn't. It's 45 exactly. So thank you very much for listening to me. In the follow-up document from this webinar, I will include the proposals from both workshops conducted, so you will be able to read them properly and think if you would like to conduct similar workshops in your region, in your NMOs. And you will see also the differences between those two workshops, because one of them was aimed on migration and asylum seekers mostly. The other one was mostly aimed at refugees and their situation. So you will be able to access all the documents, and if you would like to conduct any of those workshops, just contact us, Hana, or anyone from the international team or your regional assistants, and I'm really sure they will be just helpful to help you with to conduct any of those workshops if you would like to work on the topic of refugees in your NMOs. So thank you very much. And right now I will change the presenter to our last speaker. So since Jessica will be not able to speak today because she has some issues, we'll proceed to Dr. Meira Yassin, DNP-RN from Palestine/USA, and she will speak about medical students in the field and the experience, her own experience, how it is to work with refugees in the field. So I'll try to change presenter right now. So Meira, you should have the right to present. Yes, we can see your screen.
Yes.
Yes, we can hear you.
Can everyone hear me? Okay,
yes,
great. Thank you all very much for attending today, for your time, and for being part of this. And I also want to say thank you to all the people who have invited me to not only be part of this, but the IFMSA, I actually got connected with them in December of 2014 and started collaborating with them. So my background is I'm a registered nurse, and I just recently completed my doctorate in nursing practice, really with the aim of wanting to do more work with refugees. So my background is training as a family nurse practitioner, and now I'm currently doing another certificate in psychiatric mental health in order to hopefully do more. So I'd like to share with you all some experiences that I've had working with refugees in, see if I can move this somehow. Maybe minimize it. If there's a way that I can share with you. So I'd like to give you just a little bit of background about myself. I started working with refugees and with the Palestine Children's Relief Fund as a volunteer in 2011. So with that, I started to see, I visited refugee camps in Palestine and really started to get a better understanding of what the challenges were that refugees face. And so in 2013, I was able to visit different refugee camps in Palestine, and then in 2014, started working primarily with refugees in Jordan and as well in Greece. So Remote Area Medical is a local organization here, that's RAM, that works with the refugees that are in Greece. So I've gotten to see the challenges from both the perspectives of the refugees who are just arriving off of the boats in Greece, as well as the refugees who have resettled into Jordan and to Palestine. And so they do have very different challenges that they face, but some similarities as well, based on not only the health challenges that they face, but the humanitarian aspect due to their refugee status. So I'd like to talk about that today. So I did a medical mission with the Flying Doctors of America, and these are some of my colleagues that were with us for the Syrian refugees that were in the northern part of Jordan near Zaatari camp, but not inside the camp, because inside the camp they already have very many resources and people working with Zaatari refugee camp, organizations such as Save the Children, Doctors Without Borders, the Syrian American Medical Society. So we really wanted to target the refugees that were living in camps outside the main camp, just in tents in very remote areas. So these are people that you can see in this picture here. They live in remote areas where it takes 2 hours to even reach them. And so if you think about their challenges related to health, they don't have adequate nutrition. Some of the children are barefoot. They don't have adequate clothing and shoes. And their environment in which they live exposes them to many illnesses, exposes them to bacteria, to germs, to illnesses based on the environment, and they're not having really good insulation from dust and from other environmental factors. So these are some of the kids that we saw, and as you can imagine, not only have these children left a war situation and resettled in a country where they are living with very minimal resources, they don't have the same childhood that children in more developed countries have. So even when you look at it from the perspective of normal growth and development for the children and their basic needs being met, there are so many challenges. So my aim with this today is to sort of speak about each challenge individually and how medical students and volunteers from around the world can get involved in helping with the local IFMSA in Jordan, as well as other volunteer groups. So as you can see, for the children that were in the Syrian refugee camp, a lot of those children have asthma. As you can imagine, they're exposed to dust, they're exposed to secondhand smoke from family members smoking inside the tent. And so even to provide these medical missions where we go in and do primary care for them and offer them, a supply of blood pressure medicines, a supply of antibiotics for those who are ill, a supply of vitamins, that's just something that's very temporary. Their access to primary care is very limited because they live outside of the main camp, so they don't have the same clinic that the people living in Zaatari do. And they also don't have access to mental health care. And this is a common theme for all of the refugees that I've encountered, like I said, outside of the ones who are in the main camps. But in Greece, in Jordan, and the Syrian and Palestinian refugees, they don't have access to mental health care. Those children that were living out 2 hours away from anything, no one has really gone in to see, okay, what are the challenges that they face as far as PTSD and the things that they've seen when they were young. Granted, some of the children may have been born in these refugee camps and lived in Jordan their entire life, but they still don't have the same access to care or ability to have their basic needs met in terms of ensuring normal growth and development. This is something that I'm going to talk about, but it's connected to is, in general, children with special needs, children with autism, children who are disabled, children who have other behavioral issues. They don't have any specialists to work with them, and so that's a problem for these children. They don't have the same access to these resources. And to specialized services, for example, people who have cancer, they're not able to get cancer treatment unless they go to private hospitals in which they have to pay a lot of money because their insurance doesn't cover that. And so when you look at the specialized services and healthcare from that aspect, that is also challenging. And one of the things that I always like to focus on is how we can't isolate medical needs from humanitarian needs. because the children that are living in these environments, as you can tell, if they don't have basic nutrition, if they don't have safe housing, if they don't have clothing, if they don't have access to education, then of course treating them for an infection will help, so that their infection doesn't spread, but at the same time, it's not going to fix the underlying issues which cause them to get sick in the first place. So this is one of my passions, is really focusing on how can we combine the humanitarian needs with the health needs. And so that's something I'm going to be talking about here too. This is one of the children that is in Gaza refugee camp. We did a distribution of winter items for these kids, and this was a little boy with special needs, and he was just the cutest little child. But the children that we were trying to focus on that day was this marginalized population of children who are already undernourished, who are already suffering from chronic conditions that they were born with, and then on top of that, they don't have adequate housing, they don't have adequate clothing. So you can try to work with them on their underlying medical issues, but then it goes back to the humanitarian needs have to be addressed as well. And something that I like to point out, and this is something we discussed that I really wanted to address for the people that want to volunteer with refugees, we can't look at refugees as people we should feel sorry for, or, oh, look at them, they're coming off these boats and, they're in a bad situation. The honest truth is that that could have been any of us. How come they were born in this situation in which this happened to them, and we are living, our lives in areas where we have everything we need? So for people who want to go and volunteer, it's something that you have to kind of mentally prepare yourself for. Some of the people that have gone with me have just been completely shocked when they've gone to see the Syrian refugees or the Palestinian refugees living in Gaza camp. It is very heartbreaking, but at the same time, it's very empowering to know that we can work together to make it a better experience for everyone. For medical students who want to come, for example, a lot of people ask, okay, well, if I want to come on a medical mission, can I be a doctor and start diagnosing and treating and doing all these things? Well, you can do what is within your scope of practice, and also realize that there are many other ways in which you can get involved that kind of combines, as we've mentioned, the humanitarian and the medical aspect. One of the things, for example, is for the people who are able to, for example, like teach first aid or basic life-saving skills to people that are living in these remote areas where the ambulance can't even reach them. So that is one thing. Another thing, for example, is working with them and teaching English to the refugees, because that's something that will allow them to be able to communicate with more people and to also have better job opportunities. So when you look at it as the situation as a whole, there are a lot of ways in which people can get involved, and there are different organizations. So for those who are very seriously interested in joining on medical missions or on humanitarian missions, please feel free to reach out to us. And there are many ways that you can go about doing that. For example, you can join the Syrian American Medical Society or the Flying Doctors of America. You can work with the IFMSA students. They're a wealth of knowledge and information, as well as the humanitarian aspect for people who want to come and to work with refugees in a way that empowers them and to bring communities together. That's what we really focus on. So other things like helping to improve their basic living environment, working on trying to improve their houses, to develop or to address the underlying issues. For example, when I was there this summer, I asked many of the mothers about their access to mental health care in Gaza camp and sort of what are the issues that they face. So one of the things they were telling us, for example, is children don't have safe places to play. The playground equipment in which they play, it's broken. and they don't have safe spaces like parks or gardens or even indoor spaces besides school that they can go to. So then that leads to them playing outside on the streets, that leads to them staying inside their already, cramped homes and not having ways to productively get out their energy. So in that aspect, addressing that issue of having a safe place for them to play will address their underlying mental health needs, and then in turn the psychosocial support that you do for them will be more effective. So really in all of this to say that tying in humanitarian and medical aspects is so important, not isolating one from the other. And I really appreciate everyone listening. This was one of the Syrian refugee camps that we went to as well, when we were distributing blankets, and also we did community resiliency model training for the people living there. So if anyone does want to get involved with our efforts or any of the efforts of the medical organizations or anything, reach out to me and I'm more than happy to answer questions and to connect you with whatever resources you need. And there's a lot more that I wanted to say, but I think that I have only 15 minutes, so if anyone has any questions, just let me know.
Thank you very much. You are exactly on time. So thank you very much for your outstanding presentation, for sharing
You're
your
welcome.
experience.
Thank you all for inviting me to speak.
And right now I will share again my screen. So we are coming to the last part of our webinar, which are the questions and answers. So at first I need to find those questions here because I'm not familiar with the application. Yes. Okay. So we have the first question here from Sayeda, and the question is directed to Karim. And the question stands for our participant didn't understand the female education part you were speaking about in your speech. So if you can explain more, and again, Karim, about the female education and its importance when we're talking about refugees and education of refugees. Have you heard me, Karim? Okay, I'm checking what is happening right now. Karim, can you speak right now?
Oh yes, now I can speak.
Okay.
Because you had to unmute me first.
Yes.
So I can't really read the questions, but would you please repeat it?
Okay. Yes, I can't share the questions with you. I tried it, but it seems I can't. But the question is that Saida didn't understand the female education part because she had a bad connection, I think. So if you can explain again the female education part you were speaking about in connection to education of refugees, female education.
So the part I was talking about, the part that we addressed during the UNHCR annual NGO consultation, which was tackling sexual gender-based violence, stated that 50% of the refugee female pregnancies was due to was actually caused by aggressions from their teachers, and this is one of the determinants that determines whether females can get a proper education as refugees in their hosting countries. And this is what affects their education, their overall long-term, progress and graduation in their hosting countries. So, when we look at it as sexual and gender-based violence as one of the determinants of females achieving education and attaining jobs and higher degrees, it's very difficult. And this is what was how can we tackle. Not only do we need to eliminate sexual gender-based violence as the big picture, but also for young girls, particularly refugees, seeking education and going to schools and trying.
We are losing you right now,
society. How can we minimize these determinants that affect their overall progress?
Thank you very much, Karim, for the answer. I hope, Sayeda, you got your answer to your question. So we can proceed to another question, and Hilal asks us if it's possible to conduct these SCORP workshops on a national level by the NMOs, and is the process similar to conducting a TNHRT? So from my part, I can just answer that for conducting these workshops, you need to have a person, a TNHRT trainer, experienced in the topic. But so far, we don't have any process similar to conducting a TNHRT for this workshop. But we can share, if you're interested in conducting these workshops, we can share with you some proposals, some agendas, and in the communication with the trainers you will have, we can plan something for sure, and also with the cooperation with your regional assistant, who can also provide you some know-how and experience in the topic. So Hana, you can add something to it if you want to say something, because you are
sure.
responsible for it.
Is my mic on?
Yes.
Yeah, your mic is on.
Awesome. So yeah, I agree with Michael. When it comes to capacity building activities, there's no limitations when you're going to conduct them on a national level. The important thing is that the person that's facilitating the workshop is both knowledgeable on the topic and also knowledgeable in regards to presentation of sessions, so that we make sure that the quality of the sessions conducted are as high as possible. Preferably, it would be nice if the person has attended, for instance, a TNHRT and a TNT, a training new trainers workshop, so that they have the skills to be able to do it. But yeah, there's no limitation. We don't have regulations in regards to other workshops than TNHRT currently.
Thank you very much for your answer, Hana. So let's go to another question. And Asia asks us if we can have the record of the webinar as well. So yes, I can answer this one. We are recording this webinar, and we'll try to upload the recording on the YouTube, on the official IFMSA YouTube channel, if it will be successful, because we are doing the webinar for the first time and really hope that the recording is working, and then in the end we will be able to upload the recording to the IFMSA official channel. So if you will be looking for the record, it will be uploaded to the official IFMSA YouTube channel. So I hope I answered your question. So let's proceed to another question from Janielle, which says, I'm reading, being a relatively small island of the Caribbean, Jamaica, I can safely say, does not experience refugee-related issues as severely as countries that share borders. Nevertheless, understanding the global issue and its importance through our social media accounts, SCORP J on Instagram and GEMSA SCORP on Facebook, we have begun to highlight the very important issue of refugees. My question, however, is how do we go beyond speaking about the issue to our members and put our knowledge into action, as well as convey to our campus and wider society the importance, when truly it is not one of our biggest challenges in the country?
Answer it?
Hana, you can start if you want.
Yeah, sure. I think it's quite a relevant question because the Standing Committee on Human Rights and Peace is very broad. There are a lot of topics that we can cover. There are a lot of topics that we work on. When it comes to the work that we do on a national basis, it's important to really highlight what the needs of your country is. What is it you need to focus on? Are there specific topics where you can make the most impact and the most difference? At the same time, it's important to also understand that you're a part of a world community. And that also entails then that understanding different topics, for instance, refugee rights and the issue of displaced persons and so on, even if it's not a part of your own country's issues. So your question was mainly how to share this with people in your community, even though it's not a huge issue, right? Did I get that right?
Yes, the question was I can cite it again. However, is how do we go beyond speaking about the issue to our members and put our knowledge into action, as well as convey to our campus and wider society the importance, when truly it is not one of the biggest challenges as a country?
Well, as stated, there are things you still can do. I think that knowledge is power, and understanding things that aren't just relevant to your region or your country is important. Ways to do it is to either get involved in these kind of campaigns that we might have, capacity building campaigns, join them, to try to see if there's anything on an international basis you could do. Now currently there's you could sign your name on to With Refugees, which is sort of a campaign where people sign on their names, and that it will be later on shared on an international basis to try to legislate for refugees' rights and increase their rights. Other things is that in the region of the Americas, there are issues regarding refugees and issues that they face. So as a region, one can still collaborate and help each other out. Did I miss anything, or has somebody else something to add to that? Is my mic still on? was that okay, or is somebody else something to add?
Yes, I don't know if Michael's speaking, but just to add to what Hana has said, and also what Miria has discussed during her presentation, there are many, many ways to get involved, and refugees is not just bound by country, it's not bound by borders, it's become a global issue, it's become an epidemic. So even though if Jamaica as a country does not face the same struggles or the same burden that other countries do face, it's very important that they do actually get actively involved in the process of advocating for the rights, because as refugees can only attain their full rights if there is a global movement that acknowledges and understands their rights. And this can only happen if all countries, not just the ones that are affected or not just the ones that are hosting countries, do take an action and do take a move. Miri have stated many examples of how one can get involved, as well as Hana when she mentioned With the Refugees campaign, which is really an amazing campaign by UNHCR. And once the names, if you sign your name to this petition, it will be presented to the UN and the Human Rights Council to try to advocate for obligatory rights other to human rights, to refugees' rights, in comparison to the Convention for the Status of Refugees, that although it does have signatories, it does not oblige member states to act by them. So there are many ways to get involved, and just like Hana said, it's not just because your country is not affected. We all need to address this global issue.
Thank you very much, Karim and Hana, for your answers. So we can go to another question. Sieda is asking the question: being a dweller of a country where a refugee problem does not exist, how can I contribute? So I think we already mentioned in the previous question some contributions, also from Hana and Mira and Karim. And I can also personally say, because I come from Slovakia, and Slovakia is the country where the problem of refugees is also not very visible, because we don't have refugee camps, and also we don't have many migrants transiting throughout the country. But still, as Hana and Karim mentioned, there are many, many ways how to get involved in the topic of refugees, and mostly how we do it here. The really big problem is the public opinion and the opinion of young people towards refugees, and maybe the way would be also to try to work on this topic and try to work on this approach to the communities, to the people, and try to I wouldn't say build capacity, but try to somehow change the ideology of the population. Because when you are working with people and you're trying to approach them and to change their thinking towards refugees, to be more tolerant, to be more pro their rights, then you can change the opinion of the whole country. And as Karim said, the opinion of the countries within the global system, within the international system is really important, because Karim was speaking about all those conventions and international documents, and by the changing of the approach to population, you can really do something. And you can still work with medical students, as we mentioned our capacity building projects. So you can also work on that issue. You don't have to go exactly to the refugee camps and work there, as some people are doing in countries where the refugee problem is present in that way. But you can also work in those other approaches. So, does anyone else have something to this question? How to answer? Hana, Karim, Meira, or should we proceed to another question, because we still have a few minutes?
No, I think sorry, Hannah. I think you've covered it pretty much. I just also one thing that I missed to mention earlier is, you know, involvement doesn't only mean national involvement. You can also get regionally involved and internationally involved with find your national society for the Red Cross or the Red Crescent and see what they're doing regionally and internationally. You can become one of their members or one of their volunteers as well. IFMSA does a lot of work regionally as well and internationally, so you get part of those. The work doesn't, your impact doesn't always have to be nationally. You can go way beyond nationally. So always think outside also the national context and see what you can contribute to.
Thank you very much, Karim. So let's proceed to the last two questions. So because we don't have more time. So we have a question from Hilal. Is there a possibility for the IFMSA to initiate and coordinate regional projects that helps NMOs who are directly dealing with refugees to help those who have a refugee crisis? So
I'm not sure if I get the question. Is it if IFMSA can coordinate it, or do you mean can IFMSA members like NMOs be involved?
The question is there a possibility for the IFMSA to initiate and coordinate regional projects or some actions, I think, that helps NMOs who aren't dealing with refugees to help those NMOs who have a refugee crisis? Something like, maybe I understand it as something like a buddy system or buddy support system from NMOs which are not dealing with refugee crisis to the NMOs which are in a high burden of refugee crisis.
I'm not sure if that's how I understood the question, but when it comes to like supporting countries that are directly affected by different conflicts or war, usually there are different ways of doing it. One way is by building capacity and increasing knowledge on the topic of refugees in more countries than just the ones that are affected, so that you
I'm sorry to interrupt you, but just he'll clarify the question. He meant exactly something like a buddy system, like NMO which is not experiencing the refugee issues, to support some NMO which is in a high burden of refugee issues.
I think when it comes to these kind of initiatives, it's up to the NMOs to do those kind of initiatives to create buddy systems. You could always discuss it with the internationals team to see if there's some kind of coordination that could be made. We also have, for instance, if they're working on similar activities or projects, they could always enroll it within an IFMSA program. And by doing so, you could have some kind of collaboration through the program coordinators who could coordinate it in that case. But I think it depends on what the outcome and the intent of that collaboration would be before establishing something like that.
Thank you very much for the answer, Hana. So I hope this answer gave you some clue, Hilal, about how we can proceed with this question. And let's go to our last question, because we should finish soon. So Asia is asking us if we can get more information on how to be involved in refugee-related activities, especially in the field. So from the point of this webinar, I would just tell that after this webinar, in the course of a few days, we are planning to send a follow-up emails to all attendees, and we'll try to make a comprehensive summary from all the presentations, including Meira's presentation, who mentioned a lot of possibilities how medical students can get involved in in work with refugees, and also inside the IFMSA and outside of the IFMSA. So we'll try to include those possibilities into that follow-up email. And maybe I really hope that you will find some things, some actions which are interesting for you, and you will be able to join them and get to those information about these activities.
One thing I'd like to add, if that's okay. This is Mira.
Go ahead, Mira.
Okay. I just wanted to add that if anyone wants to get involved and wants to reach out to me, I'm more than happy to enter emails, or if anyone wants to connect with me on Facebook. The question that they were asking about local projects, the projects that I've done have been with the local IFMSA in Jordan, with the Jordan University of Science and Technology and some of the other students there. Because I'm not actually in the IFMSA and I'm not actually a medical student, but I do a lot of work there in partnership with them. So if anyone wants to join our efforts, or if anyone has specific projects that they're interested in doing, I'm in Jordan usually every summer and every winter, so I'm more than happy to, to start working on something if people have specific things that they would like to get involved in.
Thank you very much. We will try to include this information to our follow-up email, so I'm sure participants and medical students and generally all students who are interested in the work in the field will be able to get to those information, and they will be able to join your activities and any activities connected to this topic. So right now, I think we are also over time, and we do not have any other questions to be answered. So I think the only thing which is left. Okay, we just got one last question. May we have the email ID or Facebook to Meira?
I'll type it in the chat, and then you can have my email and then how my name is on Facebook, so people can add me if they'd like. And to see some more of the pictures and videos of the work that we've been doing. So.
Okay, thank you very much.
So right now, I would like to add one last thing before we end this. There's also another way to get involved is stay tuned for the call for internships also at UNRWA. Their headquarters in Amman in Jordan is a great way also to get involved with organizations that work directly with refugees. So there will be a call sent soon. So stay tuned for that, and yeah. Just seconding everything that Miria had said and ways to get involved. So good luck to everyone, and thanks for tuning in, and hope to see you guys and speak to you soon.
Thank you very much, Karim, and also thank you for your closing remarks. So Hana, would you like to proceed also to your closing remarks?
Sure. I think that this has been quite a fruitful discussion, and I'm happy that you all joined. I think there are a lot of things that we can do within the topic, and we don't only have to seek outwards in regards to creating initiatives. We can always look inwards as well, and I've been involved in creating activities and projects on the topic of vulnerable groups before within SCORP. So if it is things that you feel are necessary or needed in your country, you can always start it yourselves. And this is the first step by joining this webinar and joining our campaign. So thanks for being here, and I'm glad to have joined this process.
Thank you very much, Hana. Meira, would you like to also say some nice words for the end of our webinar?
Yes. I would like to also add on what you all were saying about how important it is to share the stories of these refugees and to really humanize them, because they're not just numbers of people who left the country. They're not just people who are affected by war, and a lot of them don't really even like to be called refugees because they all had lives before they left whatever country they came from. There were so many stories that I could share with you guys about some of the people that I've talked to in Greece and in Jordan, just about seeing, their family members killed in front of them, their entire life destroyed in minutes, and all of these things. So the more that you can connect faces to these people and really humanize them and give them a story and be for them, the more that we can change, internationally how we view refugees and what we can do to work together with them to make, situation better for everyone. So I really appreciate everyone coming, and I appreciate you guys inviting me to speak. So thank you to everyone who took their time out to listen today.
Thank you very much, Mira. And lastly, I would also like to thank you all for joining us today. Thank you for finding 1 hour and 20 minutes to devote to the topic of refugees and to devote to SCORP. I would like to also thank you for participating in our World Refugee Day campaign, because this webinar is the end of our World Refugee Day campaign. You may have seen some posts being posted into SCORP official IFMSA SCORP group. So this webinar is the end of this campaign, and I would like to tell you that you will be getting follow-up emails in a few days, and also the evaluation forms for the both webinar and for the overall campaign. So I would really like to ask you if you can just find 5 minutes to fill those emails in, like to fill in those evaluation forms, and with the follow-up emails we will try to share with you the presentations and the information we provided here in this webinar. And I really hope that you will find them useful, and they will help you to also start some activities connected to refugees and their rights in your NMOs. So thank you very much for your attendance, and I'm really looking forward to also meet you during our next webinars. Let's hope we'll prepare some other webinars, and thank you very much and have a nice day. And I think we can end this right now. Or do you have anything else to say, guys?
No.
No, goodbye, everyone.
Okay, goodbye,
Bye.
everyone. Thank you so much for your attendance, and have a nice day. Bye-bye.
Thanks, everyone. Have a good day or night wherever you are.
Bye.